When our pets are unwell, investigations such as a physical examination, X-rays, or ultrasound do not always provide all the answers we need. In these instances, we need to take a closer look inside your pet's body. Sometimes this will involve surgery, but often it's possible to look inside the body by performing endoscopy. Endoscopy is a non-invasive procedure which uses a long, thin camera called an endoscope to look closely at the organs and tissues inside the body. There are several different types of endoscope. Each one is specific to the area of the body that needs investigating. The most common types of veterinary endoscope include a gastroscope, which is a flexible endoscope used to look at the esophagus or food pipe, stomach, and intestines. A bronchoscope, which looks inside your pet's airways from mouth to lungs. And a rhinoscope, which looks inside your pet's nose. An endoscope can also be used to remove objects that your pet has eaten or inhaled. These objects, known as foreign bodies, can get stuck and may lead to serious complications if not removed. Your local vet practice may be able to perform the required endoscopy, or you may be referred to an internal medicine specialist. Your vet can help you and your pet prepare for the procedure, including specific guidance on feeding. This guidance will depend on your pet's individual needs and what procedure they will be having. Once your pet is settled at the hospital, the vet will perform a physical examination and diagnostic investigations. These may include blood tests, X-rays, and an ultrasound or CT scan. Your pet is then prepared for their endoscopy and given a general anesthetic to keep them still and comfortable throughout the procedure. The endoscope is carefully and slowly guided through the area of interest. This will either be down the esophagus or food pipe to the stomach and intestines, through the trachea or windpipe to the lungs, inside the nose, or through the anus. As the endoscope moves through the body, the vet watches for any abnormalities within the tissues. The endoscope blows air to expand some areas of interest, allowing the vet to take a closer look. Sometimes sterile saline is put through the endoscope to wash the lower airways and capture a fluid sample from the lungs for testing. An endoscope can also collect tissue samples or biopsies. A biopsy is taken using a small pair of forceps which are pushed through a port within the endoscope. Once the vet has fully inspected the area of concern, the endoscope is carefully removed and set aside to be thoroughly cleaned. Following the endoscopy, your pet will spend some time recovering at the hospital, where they'll be closely monitored by a team of nurses until they have fully recovered from their general anesthetic, which can take up to 24 hours. The samples taken during the endoscopy are sent to a laboratory where they're analysed by a pathologist. It typically takes up to 1 week for the results to return. The results from the samples, along with the blood tests, scans, and images from the endoscopy, are carefully reviewed by the vet. This allows them to make a diagnosis and to recommend a treatment plan. The vet will discuss the diagnosis and recommendations with you, and together you can decide the best course of action for your pet. If you have any questions about your pet, please talk to your vet.